Hello and welcome everyone to the International Orby Foundation Executive Interview Series 2025. This year we are proud to celebrate our 25th anniversary in Cartagena de Indias, Colombia. It's a must-visit event for those interested in occupational health and safety. And today we are honored to be joined by Nick Paul, the Chief Executive Officer of the Society of Occupational Medicine. Dear Nick, we are delighted to have you with us.
My pleasure to be here. Thank you.
Thank you. Nick, would you like to introduce the Society of Occupational Medicine, or would you rather prefer me doing this?
I can do it. So, the Society of Occupational Medicine is a professional organization for occupational health professionals. We publish the academic scientific journal Occupational Medicine, which members receive. Whole lots of webinars and education, and lots of useful tools. There's a publications catalog which is free for anyone. You don't have to be a member. We also work globally. We have projects in Nigeria, Ethiopia, a small-scale mining project in 4 countries, and we host the International Occupational Medicine Society Collaborative, which is a organization of organizations, including the Colombian one. So, yes, we try to improve occupational health through our members and generally through our advocacy and policy and reports and publications. Thank you.
Thank you so much for sharing. And before we begin, here's a quick roadmap of the 2 days conversation. We will begin by taking a look at the Society of Occupational Medicine and its impact. Then we will explore the role of modern technologies. After that, we will focus on small businesses. And finally, we will reflect on the role of global events. That sounds about right. Nick, shall we begin?
Yes, let's start.
Perfect. Let's get started. Nick, as Chief Executive Officer of the Society of Occupational Medicine, could you please walk us through one recent initiative, perhaps from policy engagement or educational programming, that you believe is actively shifting the way occupational health is perceived in the United Kingdom and internationally?
Yes, so the Society of Occupational Medicine with the International Occupational Medicine Society Collaborative hosted a meeting in Geneva in May last month with the International Labour Organization and the World Health Organization, looking at what chief medical officers of corporates, companies, concerns and plans were and how they could contribute to the UN Sustainable Development Goals and the ILO WHO objectives. I think they were concerned about two things, which shows the relevance of occupational health. Firstly, I think they're concerned around heat stress and climate change impacting on worker health. And we had really good presentations about how occupational health can assist workers through access to cool water, shade, the hierarchy of controls to reduce their risk of having heat stress. So that is definitely something that is of concern to the world and where occupational health can show its relevance. I think another area that chief medical officers who we hosted were concerned around in the immediate term was mental health. I think people in workplaces are concerned around stress, that there's perhaps a risk of burnout in high occupations. How do you improve the mental health of your workers? And I think you have to take an organizational, cultural approach, work with managers. And there's lots of poor practice there. And I think occupational health are trained, professionally qualified, have the evidence and scientific knowledge to work with organizations to improve people's mental health. There's lots of products, apps, or services that perhaps aren't evidence-based. And I think it shows the value for that big issue of mental health in the workplace. And also, technology can be useful, say for heat stress, certainly can be useful in terms of monitoring that. So I would say mental health and heat stress are, due to climate change is a particular area demonstrating the relevance of occupational health.
Cannot agree more. This sounds like a major step forward.
It was, yeah, thank you.
And moving on to the next question, the integration of artificial intelligence and digital monitoring is reshaping workplace health and safety. From your perspective, how is technology transforming the day-to-day work of occupational health professionals?
Yes, good question. AI is of concern, but also interest to lots of people in our day-to-day work. We have AI obviously in terms of taking notes, and I think it can really be of value to occupational health in terms of reducing the administrative burden of writing reports and doing that background documentation. We know in the UK there was a study which showed a GP, a primary care physician, can use AI to save 7 minutes per consultation time. It takes 10 seconds for AI to do it. Clearly, you need oversight in terms of quality from human kind of oversight, whether it makes sense that AI doesn't get it right as humans do. But I think there's a real administrative efficiency savings from AI, which we need in occupational health because we know we haven't got enough occupational health, both doctors, nurses, occupational hygienists, etc. But also, I think AI could be useful in terms of data and how occupational health in large companies, for example, can use the data that they have from of the health of their workers to understand if there are other particular teams that are struggling and need extra support. What are the trends that you can really work from in terms of particular issues? Is it women's health at work? Is it, for example, because the data is showing that women are taking more time off? So I think using data through AI to make better and more effective decisions quickly will be of real value. As much as we also need to be mindful of ethical concerns and good practice, in terms of that is being produced. And we want a human-focused approach to AI rather than AI obviously driving things.
That is a fascinating shift. And if you don't mind me asking, what opportunities and risks are emerging as a result of applying artificial intelligence?
Well, I think I've covered the opportunities in terms of greater administrative efficiency, better use of data. I think the risks are um, not having that human oversight, that the mistakes are coming through. There's concern that AI is biased in terms of where it's collecting its data, in terms of, I don't know, gender or race or other protected characteristics. So I think you need to understand how AI is producing that sort of data. And I think there's ethical concerns in terms of where that data is received from, that people understand how their personal data will be used. There's some very good guidance coming out, I think, from EU OSHA and other organisations. Certainly, we've got an AI working group, and we've got some interim guidance. So it's about people coming together and using it in the way that works for them. Um, Considering those ethical concerns, those data concerns, but certainly an opportunity for occupational health to show that it can innovate and innovate fast, and AI is clearly one of the major sort of innovations of the moment.
These are great takeaways. Thank you. By the way, in the year 2022, the Society of Occupational Medicine released a global version of its value proposition for occupational health report. And building on that, what do you see as the next step in encouraging employers, particularly smaller organizations, to recognize the importance of investing in occupational health?
Thank you. Yes, I think the return on investment is that key conversation that occupational health needs to have with small, medium, larger organizations. And these are tough economic times, and I think the three areas that value proposition document identified were that was making the moral case, it's the right thing to do. There's a legal case, there's government regulation, you must do it, and then the financial case in terms of the return on investment. And I think the financial case is the preeminent one at the moment. So I think it's about how we explain to chief financial officers or people in those financial controlling positions in organizations what occupational health can offer. We know from that value proposition document that occupational health can reduce the number of sick days by 20 days a year. If you calculated what that would be, then you'd easily make the case for occupational health. And we also know that there's some very straightforward things that occupational health can advise on, like musculoskeletal issues. I've talked about the mental health issues. So I think it's difficult for SMEs, small medium enterprises, to make that decision, but they need to see occupational health as their sort of professional expert advisor in workplace health, just as they have expert advisors for legal, their lawyers, or they have their accountants. So it's that suite of support. And I think that case is made both in terms of the figures, but also stories, plenty of stories of how people have, with complex issues or issues that maybe just even straightforward and quite simple. That combination of getting the right narrative right, the figures, and to just also just different organizations have different ways of making that case. So you need to understand the culture of that organization and present in a way that makes sense to them.
Absolutely. Changing mindsets is one of the hardest but most important
Yes,
parts.
yes.
Great. And our final question is, as we approach the 25th anniversary of the International Orpi Foundation in Cartagena de Indias, Colombia, I would love to hear your perspective. How do you view the role of international events like this in driving meaningful progress in occupational health and safety?
Well, congratulations on your anniversary. That's fantastic. Well done. And I can see you're going from strength to strength. And congratulations also for hosting it in Cartagena in Colombia. Beautiful country. I was with the Colombian Occupational Medicine Society in May in Bogota. So all delegates will really enjoy their time in Colombia. They've got a very strong occupational health, actually, and I think it's good to really realize that perhaps our perception of a country like Colombia is incorrect. They're very professional, effective, great leadership. Um, and so we can always learn international collaboration. For example, we've learned about heat stress and climate change from at our conference recently, people from California. We've also learned an emerging issue here in the UK is silicosis from people cutting silica-based kitchen worktops, and that was an issue that emerged from Australia. And so, if you do understand the emerging kind of industrial occupational hazards and work quickly, as we're trying to do here in the UK, learning from Australia, then lives can be saved. So that international collaboration, understanding, and learning is really effective. You can end up doing things that are not effective, as I talked about in terms of mental health. Um, and you can learn from colleagues from around the world on their strategies. Some brilliant models, for example, in India on basic occupational health services. Some really exciting work in Colombia, I'm sure people will learn from. And there's also the different regulatory structures. We do work in different regulatory structures, but there are some ways in which when you advocate to government, building off the ILO conventions that have recently been signed on biological hazards, which is brilliant, and congratulations to ILO for that. But also using sustainable development goals to learn from how people have talked to their policymakers on making the case and making the change, so that around the world, different countries can improve their occupational health and safety. So these meetings, you need to be careful in terms of obviously meetings that have purpose, but I'm sure if you have purpose and good speakers and clear outcomes, then there'll be a success.
Thank you for your warm words. Collaboration is where real momentum starts. Thank you so much for this insightful conversation. And before we close, is there one final thought or a piece of advice you would like to share with our audience?
Well, I think one thing that we're interested in is, as you've asked about, is making sure occupational health is as relevant as possible to people's current needs. We're doing a really exciting project supported by NEBOSH, who are the occupational health and training organization, on small scale mining. And also we have funding on a project on health of healthcare workers. We know that certain occupations have higher risk, so do focus in on those higher risk occupations. Healthcare workers have higher stress and burnout. So I'm sure people are thinking about targeting those people. And also there's emerging risks I've talked about in terms of heat stress and climate change. And we're concerned around mining. There's going to be a lot more mining over the next 50 years to deal with the energy transition to electricity. A lot of those mines won't be as part of organizations. There'll be people at a small scale level, and we're concerned, and thanks to the support of NEBOSH, trying to get occupational health to those communities. So it's about staying relevant, using technology, but fundamentally, it's about keeping workers healthy and safe. And that person contact is nothing like being there talking to workers and understanding what their concerns are. So understanding them, those concerns, and then working with them to find the solution.
That is so true. Thank you so much, Nick, and thanks to everyone watching. We look
Thank you.
forward. Thank you. We look forward to seeing you all in Cartagena de Indias, Colombia, to celebrate the 25th anniversary. Until then, stay connected, stay inspired, and stay safe. Bye bye.
Bye.